Good afternoon, everybody. A very good afternoon to the viewers who are, watching today's topic on Mental Health Day. Regarding Mental Health Day, we observe the Mental Health Day on 10th October every year. So today we are discussing on the importance of Mental Health Day and also this year's theme of mental health. So, to the viewers and the people who are listening to the mental health program, a warm welcome to all of you all for the mental health celebrations. And first, let me start how this Mental Health Day was formed. Regarding World Mental Health Day, it was formed in 1994 actually. It has been said by the World WHO that how mental health is very important and it has to be given a date for its celebrations and to observe the awareness programs and the quality of mental health. So October 10th has been given the day of celebrating this World Mental Health Day. This is to increase the awareness and increase the importance of mental health activities and mental health personnel and mental health as such in the whole. So this year's theme of World Mental Health is mental health in an unequal world. Means actually to raise awareness to the people who are not having accessibility of mental health. It is mainly regards to accessibility of mental health in the whole world scenario, and there are a lot of differences in providing mental health services. Hence, this theme was selected because unequal world means to say there is no equality in all sectors of life. There are differences. If you take the world scenario, you have differences with the race factor, culture, ethnicity, and gender discrimination, sexual orientation. These are the major discriminative processes where gaps live in, and of course, the lower and higher economic statuses and the people who can afford and non-affordability. So these all are the factors for inequality in the world scenario. Now, coming to the mental health in Indian scenario, it is mostly the accessibility of mental health services. If you see mental health services, the accessibility of mental health is 75 to 90% is not accessible to the people with the low and middle class economic statuses, and even in the high economic status people, there is a limitation and there is a partial intake of the accessibility of mental health services. That is because of various factors, and various factors due to the disabilities, due to the stigma attached to it, and the entire knowledge on mental health itself to some extent. That is the reason we see a lot of celebrities also speaking about mental health services and the mental health problems like depression and all, where it is they have raised awareness that each and everybody should take the mental health services as an important aspect in their lives, because it affects the people in all kinds of the world. The mental health itself, if there is a mental health problem, it affects the life of a person. So it becomes very important that one has to not go for these barriers. And it has also been spoken a lot in West about the barriers of workplace also, where they have shown the differentiation between having mental health issues and not having mental health issues, and also people with psychosocial barriers and disabilities also have shown differences between mental health problems. Now, coming to India, when we talk about India as such, how mental health is accessible. When we talk about India, there is a very less number of personnel who are available to provide mental health services, and it has not been taken into account till this COVID pandemic has come into picture. It is so much of lacunae that we find 1 lakh people having only 0.29 psychiatrists and 0.067 percentage of psychologists. So you can understand that how much there is a need and how less other people. It has already been. The statistics say that there is only 890 people of psychologists available for 20,000 people. So you can understand how less the mental health services have been catered to by the government. So there is a huge need raising. And the third major theme in this on the day of mental health we have to speak is the COVID pandemic. Last year has precipitated any number of problems which raised a huge need of mental health services. And there was a huge need of people seeking the mental health services. And the providers had a lot of problems because the personnels were less and the services has to be increased. That is where they have identified the need of it. And the pandemic has brought a lot of people into depressions, and depression rates have gone up. When you see the pandemic and the COVID scenario itself, you find that there is a lot of loss in the entire world. There is a loss of people and loss, the death in every different family. So it has raised problems of depression, which is very high. And not only that, the anxiety disorders, stress, and grief disorders. And also they were, because of the huge change of scenario of isolation and, quarantining, all this brought about a lot of disturbances even in children with the huge behavioral problems because there were no schools were cut off and everything went online, and the lifestyle itself had taken a different turn. It's a huge adjustmental factor around the world to get into the new perspective of lifestyle. And the isolation was also a very major phenomena which precipitated people with a lot of interpersonal relationship disturbances, child disturbances, and also elderly people have suffered because they were having issues which were very difficult to be addressed at this scenario of COVID time and pandemic. So it didn't raise problems into a single sector of people. It has raised in a wide span of people with all age groups, and the entire world suffered from it. It was the certain culture, certain area, and certain countries were not just affected. I mean, it was not catered to one country, one place, one state like that. It was the world scenario where people suffered with mental health issues. Now, why do we have to celebrate a mental health day? It is very important because one has to understand what mental health is all about. Okay. So why we cater is to increase the qualitative aspect of the mental health and to know its importance in our day-to-day life, as well as people with suffering with mental health issues. How we have to work with them together in this world. Okay. Now, what are the things which are very much important in this mental health scenario? The major events which are very important to understand is the stigma and discrimination which is attached with it. So many people have still the stigma of, if we tell that we are having some problem of mental health, it will be a black mark on us and we cannot go to a psychiatrist or a psychologist. This kind of things have come into picture. But I'm glad as a mental health professional to say that the pandemic has brought an online services which are very good. So many people are able to come out of their problems because it doesn't require the physical aspects of going to a therapist at all. So that helped people to come out in the times of need. So one way I have seen that increase in seeking mental health professionals and services, which is very important. And also one thing, another important aspect which you need to understand is that mental health is not alone working with medication line and all. Okay, one has to understand the importance of therapy and counseling services, which everybody in the world have understood now because of the pandemic. And now they seek a lot of help regarding therapy and counseling services. They need to discuss the problems and talk out and then work it out. Mostly, talk therapy is very useful. Another important aspect they have also realized is the comorbidity with the physical problems. The lot of physical nature problems like neurological deficits, cardiology problems, or gastroenterology problems. Any physical problems also raise a lot of need for mental health also to be good to take in the physical aspects of it. And they have observed that if you have mental health issues like depressions and anxieties, the physical nature and the physical illnesses have taken a lot of difficult time period to work it out with them. So it is kind of a teamwork where the physical problems also which have comorbidity of mental health issues have to be addressed and worked it out. Okay. Now the pandemic has shown a lot on that kind of scenario where COVID happens to be a physical problem, where it precipitated a lot of mental health issues and fear and anxieties and depressions, where a lot of mental health personnel have spoken a lot that you should not fear and anxiety has to be less so that you can work on your physical illness much better way. So these are the major issues. Other than that, we can talk, about the pandemic. If we take the pandemic has got problems into the disturbances in children also, like a lot of behavioral disturbances, and the schooling system as such was turned out to be e-learning and mostly online classes. So that has brought about a lot of problems, as well as definitely there were plus points and positiveness on online aspects, because future goes for e-learning to some extent, because the convenience of e-learning was understood only due to the pandemic. But the negative aspects were the children didn't have interactions. They suffered from having friends and acquaintances. So when these are the problems which we faced due to the mental health, so how we work it out of these problems, and why how can World Mental Health Day be useful for the society? So when we are celebrating Mental Health Day, that means to say we have to get out this kind of gaps and unequal areas to be more equalizing and getting services for them. So it is actually, there is a lot of need for the mental health. We understood by the pandemic more as such. So there should be provisions of, inculcating this kind of services to the inaccessible people, like lower economic and medical people. So the legal system and the governments should take steps, for getting the, covered, insurance covered basis to mental health problems also, as a part and parcel of the physical illnesses. That is one way to, bridge the gap of the unequal world. And the other way is to get awareness programs where there is a lot of people don't know about these services and don't utilize these services. So awareness programs by putting camps and some talks and some kind of things in remote places, not in cities and places where it is known. It has to be conducted in the remote places where, like rural areas and isolated places, and the lower economic status where they are, and keep one-day camps so that you can help those people in certain aspects of problems, telling about it and also giving services to it. So this is one way to improvise our, you know, services of mental health aspects. And another important thing is, which is easier to do, and how you can do is each one person can do is the self-care, the treatment of a self-care. You have to promise yourself that I will take self-care about myself. That means you concentrate on the working with your managing the good lifestyle management, and being positive on everyday basis, rather than being negative to people or negative thoughts to entertain in your mind. Mostly being positive and working that I can work this out to, I can work out this problem with myself. I can arrange my life with certain good exercise, good nutrition, good food, and by doing yoga, like pranayama exercises, or meditation. And doing goodwill activities like surveys, all this are very good aspects to boost up your mental health, and to maintain your problems. Even if you have one, you work it out this way, it will help you in maintaining a positive way of outlook towards world and yourself, and give you a lot of confidence inside. So one has to, make the promises to oneself, that everyday basis that you work it out with your thought processes, introspect into yourself, meditate for some time in silence, and clear certain problems which you can do yourself. And then if you, when you can't do, that is when you have to seek the services of a mental health professional. So these are some of the aspects. And you can also, now that we have a lot of services on the online provided for mental health, whether you have any problem or not, there are tests. You can take a test of assessment for yourself to see whether you have a problem, and then work it out on that kind of problems, whether it be depression, be it anxiety. Because you don't know your symptomology, you can always look up, but the excess googling is not correct. But you can do some kind of googling to understand what your symptoms are, because you work it out with your own self, psycho educating yourself, and then applying certain kinds of strategies or treatment procedures which are non-pharmacological, means without medication. You can do it with simple lifestyle changing and lifestyle management. So this kind of things are very important to maintain a good mental health. So I usually suggest a lot of people who come to me to have a good lifestyle. To maintain good mental health, and also have a lot of social interaction, and have some friends to talk it out and discuss, and keep some hobbies which you can work it out on being, even if you are alone, you can work it out on your own and find some some kind of positiveness and peace and a relaxed atmosphere. So this kind of things are very important to do it, to maintain a good mental health services. So this is where I end the topic of World Mental Health Day celebrations. I wish all of you who are watching me to take care of yourself, have a good lifestyle management, um, and think positive and maintain it. Thank you. Yo, I'm so sorry. It's